Good morning. Welcome to the 2017 Stephen E. Strauss Distinguished Lecture in the Science of Complementary Therapies. I'm Josie Briggs, Director of the National Center for Complementary and Integrative Health. The lecture today is in honor of the memory and legacy of Dr. Stephen Strauss, the founding director of this center. It was an honor to follow him in this position. As NCCIH's founding director, Steve took on the challenge of building rigorous science around practices that were a little outside mainstream medicine. View of some, a little beyond the fringe. Steve took on that challenge and showed that it could be done with rigor and grace. He was also internationally recognized for his insights into viral and immunological diseases. His team, among other accomplishments, demonstrated that acyclovir suppresses recurrent genital and oral herpes. His work on chronic Epstein-Barr virus infection led to the recognition of the autoimmune lymphoproliferative syndrome, or ALPS. Extraordinary scientific contributions by a very multifaceted, talented man. So it was an honor to follow him, and it is an honor to remember him here today. I'm especially pleased that Barb Strauss, Steve's widow, is able to join us today. This is an honor, but it's a little bit bittersweet, for I am hosting the Strauss Lecture for the 9th time, but the last, since I am stepping down in mid-October as director of NCCIH. It's been a pleasure serving in this role, watching our research evolve, and I will leave the center in the very capable hands of Dr. David Shurtleff, who will become acting director, and an incredibly talented staff. I'm very proud of the team we have built. So, moving to the topic today, stress. This will have been important to Steve as well. Stress and resilience are two major topics in NCCIH's research portfolio. How stress affects our health, and how approaches, such as regular exercise, better social connection, contemplative practices, like meditation, how those approaches can impact on stress and reduce the impact on health. A particularly important topic for us right now is the impact of stress on chronic pain. Just a brief plug, NCCIH is about to launch next week a very major collaboration with the Department of Defense, the Department of Veterans Affairs, and a number of strong NIH partners to create an extensive research network. We have commitments of close to $70 million over 5 years. The network will study integrative approaches for pain and associated conditions like post-traumatic stress, particularly focusing on military service members, veterans, and their families. We know that pain, especially chronic pain, can defy the best efforts to control it. While opioids are important, they come with the risks that sadly we are seeing all across the country. So new approaches are desperately needed. The approaches that will be studied by this network include integration of medication-assisted therapies with mind-body approaches and other non-drug approaches, innovative technology tools for better self-management, and innovative models for treatment delivery. I'm excited about this effort. Okay, now to the Strauss Lecture. It is supported by the Osher Foundation through the Foundation for the NIH, and I wanted to invite Mr. Robert Balthazar of the Foundation to make a few comments.
Thank you, Dr. Briggs. And thank you to Dr. Francis Collins and Dr. Vivek Murthy for joining us today for this exciting event, and good morning to all. I am Robert Balthazar, Director of Advancement for the Foundation for the National Institutes of Health, and it's a pleasure to be here this morning for the 2017 Stephen E. Strauss Distinguished Lecture in the Science of Complementary Therapies. The FNIH is proud to have been part of this important collaboration since its establishment in 2006. Today's lecture is made possible by the support of our partners, Bernard and Barbara Osher, whose generous gift established this event. I also want to thank the Oshers for their generous support over the years and for making this vision of an annual address given by leading figures in science and medicine who can come to the NIH and speak from their perspective about the field of complementary and integrative medicine, a reality. As you may know, this lecture honors Dr. Stephen E. Strauss, who was the founding director of the NIH Center for Complementary and Integrative Health. In a moment, we will hear from one of the nation's leading experts about a topic that I think we all can relate to, and that's stress. I know I am personally looking forward to learning what steps we can take to reduce its effect on our health and our lives. Scientific research and discovery usually works best when done collaboratively with scientists, donors, policymakers, regulators, and importantly, patients working together for a common goal. At the NIH, we know about the power of bringing multiple constituencies together to tackle pressing health challenges. The FNIH is an independent foundation created by Congress to support the mission of the NIH, and we do so by building and nurturing alliances with partners from the public and private sectors. The FNIH is nimble and proactive, raising funds to support cutting-edge research, education, training, and events at the NIH and beyond. And over our 20-year history, we have raised more than $1 billion in private sector support for biomedical research. Finally, I want to say thank you as well to our colleagues at NCCIH for their leadership and vision, to the scientists here who seek to understand how to combat stress, and to all here committed to the betterment of people's lives around the world. Thank you, and enjoy the program. Thank you.
The Osher Foundation have been incredibly important supporters of innovative, integrative approaches, so it's very moving to have their support for this event. As this year's Strauss lecturer, we welcome Dr. Vivek Murthy, the former Surgeon General of the United States. Dr. Murthy is an internist, a doc, trained at Yale Medical School with an MBA from Yale and an internal medicine residency at Brigham and Women's Health Hospital. His extraordinary achievements are listed in your brochure. He's known as a charismatic clinical teacher. He was recipient of a Soros Fellowship for New Americans. During his term as Surgeon General, he worked to make sure that some of the most pressing health challenges like Ebola, Zika, and the Flint water crisis were addressed forcefully. He launched the Turn the Tide campaign in 2016, urging health professionals to join a movement to address our nation's opioid crisis. His interest in the topic of the discussion this morning, stress and its impact on health, led him to seek me out, and because he was interested in some of the things in our research portfolio. We had several long conversations. He asked probing questions about the research we support on stress and health. So I was delighted when he returned the favor and agreed to be our stress lecturer this year. And Vivek suggested we do this as a conversation. And I was doubly pleased when I persuaded Dr. Collins to be the partner for this conversation with Dr. Murthy. So please join me in welcoming Dr. Murthy and Dr. Collins.
Thanks, Josie. Well, good morning, everyone, and a pleasure to see all of you here, and welcome also to those who are watching by video, both through the NIH feed, but also we are broadcasting through Facebook Live, so there are a lot of eyeballs focused on us right now, so we'd better make this interesting. In fact, we even have this set up so that the people watching by Facebook Live can submit questions, and there's a monitor here that's going to make it possible to incorporate those into the discussion. And I also have the opportunity to pose some questions that were submitted by NIH staff in advance of this event. Let me just say what a delight it is to have my friend Vivek here for this conversation been a great admirer of the way in which he has conducted himself as our 19th Surgeon General, addressing a lot of the issues that afflict our nation, whether it's infectious diseases that he was asked to weigh in on, such as Ebola and Zika, or whether it's the opioid crisis, or whether it's the appearance of e-cigarettes and what that should mean as far as health of our nation, particularly adolescents. But he has had this particular focus throughout his term on this whole concept of emotional well-being, and I'm sure that will be a main part of what we talk about. I do also want to say that it's an honor for me to be part of a lecture that has the name of Stephen Strauss attached to it. Steve was a dear friend and someone that all of us who got to know him during his distinguished leadership career at NIH had great affection for and admiration for, and we miss him. He left us much too soon, but perhaps in some small way today we can honor his memory by talking about issues that I know he would have very much wanted to engage with. And before I get to the first question, I have one other thing I want to say, and that is a big shout out to Josie Briggs, who did in her introduction tell you, if you didn't already know, that she is planning to leave her remarkable leadership role at NCCIH in mid-October and take on the role of being editor-in-chief of a prominent journal in nephrology. And Josie, I've had the privilege of working with you back in the day when you were at NIDDK, and then some when you were at Hughes, and then back here at NIH. And it has been an absolute joy. And Josie has taken on responsibilities that have spread well beyond the NCCIH portfolio and helped me with all kinds of other things like the collaboratory and getting the All of Us program started and others too numerous to mention. So as long as we're all gathered here, could we give a hand to Dr. Josie Briggs? You're the best. So Vivek, I'm sure some of the people here know a bit about you, but probably not everybody knows as much as would be valuable here for setting the stage. So you have a very interesting pathway that brought you to where you are right now. Can you give a description of sort of your own childhood leanings, experiences? How did you end up becoming Surgeon General of the United States and interested in this area?
Well, I still haven't figured out the answer to that question, how this all ended up happening, but I'm happy to tell you a little bit about the story. I do want to say thank you, Francis, for being here today. I'm a great admirer of Dr. Collins and his incredible work and leadership at NIH, and a big fan of Dr. Briggs as well, and I'm sad to see her leaving. And just being here at NIH brings back a lot of good memories for me of the time I spent in government and visits I made here to NIH. I know that the people on this campus, the researchers, the clinicians, the support staff, the administrators, are an incredibly important part of making sure that our country is able to address disease and illness. And you are functioning at a time where budgets are tight and where the demand for your work is growing day by day. So I want to thank all of you for the great work that you do each day. And I have a particularly warm place in my heart for our Public Health Service Commission Corps officers, and it just makes me feel so good to see so many of them here today, especially as we hear news about Hurricane Irma bearing down on the southeastern part of the United States. We're dealing with the aftermath of Hurricane Harvey, and all of these remind me once again of how important it is that we have the Commission Corps and other forces that are there ready and able to assist us in disaster response. So thank you for that incredible work. My path to being Surgeon General, and my path in general, I think is a fairly unexpected and perhaps somewhat random path, although I truly don't believe they're random events.
Maybe true about a lot of us, by the way.
But my parents actually came to this country when I was very young. They came from India. They came for the same reason a lot of immigrants did, because they wanted a place where their kids would have more opportunity and a chance for a better life and better education. And growing up, I had the chance to be exposed to medicine through my parents, because my father is a family medicine doctor. My mother doesn't have a degree in medicine, but she may as well be granted one, because she learned a tremendous amount managing my dad's office. And she delights, when my dad and my sister and I are discussing clinical cases, she delights in making sort of backseat diagnoses, as she puts it, and very often she's right. But they exposed me to medicine, and they did so in a very particular way. Which is that they allowed me to see that medicine was more than about diagnosing and treating illnesses, but it was about a relationship of trust that you build with another individual, in which you recognize that that relationship itself is very powerful and healing. And I saw that very clearly one night when I was perhaps 7 or 8 years old, when she woke me up in the middle of the night, my mother, and said, "Hey, we have to get into the car right now. We have to go." And I was very confused. I didn't know where we were going, but she put me and my sister in the car, and with my father started driving toward a trailer park in Miami. And what she told me over the course of that drive was that my father's patient, Gordon, had just passed away after a long battle with cancer. And the reason that we were driving to that trailer park was because Gordon's widow, who lived in the trailer park, was grieving alone, and they were worried about her. And so at that time, which was around 3 in the morning, they drove us all out there. And I remember so clearly as if it was yesterday, the silhouetted image of my mother in her traditional Indian sari, walking up the steps of Ruth's trailer, knocking on the door, and seeing Ruth come out with tears just flowing down her face, and seeing the two of them embrace. And that image will be forever in my mind because it reminded me of the incredible journey that my parents made from their native home in India all the way to building a life in the United States. But it reminded me most importantly of that bond that they prioritized and built with their patients, which is a true source of healing. So that was my inspiration to go into medicine. And you know, through that, I was really blessed to be able to go to good public schools, to get a good education. I wandered a lot during my education. I was interested in all kinds of different things. I took some time off to do basic science research. When I was after college, I spent time, my first endeavor in public health was actually building a nonprofit focused on HIV with my sister, which we ran for about 8 years. Spent some time in the technology space, starting a technology company there, and you know, also did some time building an organization to focus on bringing doctors together around the country to advocate for more affordable and more accessible healthcare for everyone. And all these experiences didn't seem to come together until I actually became Surgeon General. And it was when I was Surgeon General that I realized that all of the skills that I had built in those different areas, the skills, for example, evaluating web pages, which I did a lot of when I was building my tech company, and I became very good at user interface and design, the skills at figuring out how to organize and bring people together around a common cause, which is part of my advocacy work, the skills as a researcher and a clinician and an educator and communicator, those all finally came together in this role as Surgeon General. So I just felt very grateful to have had the opportunity to have served. I, without a doubt, got more out of the job than I gave, because the education I received was from people all over the country who taught me once again about what an extraordinary nation we are, about how our people, despite all the challenges they have, are still rooted in a fundamental sense of kindness and compassion and decency. And I tell people that America has always been my home, but sometimes you have an extended family that you know about, and then you actually go on vacation, you meet them, and your bond deepens even further. And that's really how it felt. I went to far corners of our country and met people all across America who were part of my home, but who I had never truly known. And it just deepened my bond and my love for our great country.
Vivek, were you, in the first few months as Surgeon General, you did this listening tour. You're referring, I think, to some of that now. And you came away from that with a series of themes that you heard over and over again that it seems really shaped the way in which you spent your time as our Surgeon General, in terms of the areas of focus that you thought maybe hadn't gotten the attention they deserved. Can you say something about that listening tour, what you learned, what it did to your own agenda?
Yeah, well, thank you for asking about that, because that was a very formative part of my experience as Surgeon General. Part of the advice I'd been given when I began office was to listen more and talk less. And I thought about that when I was beginning, and I said, you know, I have an agenda that I believe I want to implement, but what if we spent, you know, some time in the beginning just going around and asking people a simple question, which is, how can we help? And then see where that leads us. And what I saw everywhere I went was I saw people in pain. And that was really disturbing to me. And the source of pain was different. In some cases, you know, I saw families who had lost children to opioid overdoses, who were struggling not just because of the loss of their son, but because their community seemed to isolate and shun them afterward, and made them feel that what had happened to their child was something they should be ashamed of. You know, I spent time in Michigan, both during the Flint water crisis and at other times as well, hearing from patients, from parents who were just in anguish about the fact that they may have allowed inadvertently their children to drink water that was tainted by lead. But I saw, whether it was from illness or whether it was from economic uncertainty or whether it was from violence in their communities or the crisis of addiction, there was these stresses in people's lives that it seemed were causing great pain, and people didn't always know how to deal with them. But perhaps even more powerfully than that was, for me, was actually seeing how people reacted when we would talk about stress and emotional well-being. It was like a light bulb really went off. And we live in a time where people feel that we are very divided, and there are not that many issues that seemingly can bring us together. But I'll tell you that when we talked about emotional well-being, that was a time where I saw people come together around the importance of this issue more than I saw in any other issue. And it was really striking to me. And that was true whether I was talking to lawmakers, of either party. It was true whether I was talking to people in rural or urban areas. It was true whether I was talking to young people or older people. I was at the University of Texas, actually in a room with 500 students, and I asked them a simple question. I said, how many of you in the last month have experienced an almost unbearable amount of stress? And about 95% of the hands went up. And then I asked them a follow-up question. I said, how many of you felt that you had tools for dealing with that stress in a healthy way? And less than 5% of the hands went up. And this was very similar to results I saw everywhere. So that really left an impression on me, and it made me realize that if we are not addressing stress and emotional well-being, then we are missing a major, major contributor to not just our health, but to how our country functions. It reminds me of how absent nutrition was when I went to medical school. And I imagine, Francis, when you were in your training, nutrition probably didn't receive a whole lot of attention either. But we now realize that was a gaping, gaping hole in our education, and emotional well-being is no less important.
Well, certainly here at NIH, people are only interested in stress as a research question. It doesn't affect any of them personally. But just for intellectual argument purposes, let's talk a bit about this. Maybe we could even think of this national affliction as something that needs diagnosis and then it needs treatment. And so your suggestion is that the diagnosis is this is pretty serious, and also that it's more serious than it used to be, that this is not just a chronic illness, this is one that's sort of got an escalating course. And I've seen some data to support that. But what do you see from having worked on this issue now intensively are the factors that have led to that? Why do we in this country particularly now have a situation where 95% of those students say they've experienced extreme stress? What's going on?
It's a good question, and I think it's worth drawing a distinction between positive and harmful stress, because not all stress is bad. There is this stress that all of us have experienced before a big exam or before a performance, and sometimes that can actually...
An interview with the Surgeon General.
An interview with the NIH director. But sometimes, and these can enhance our performance. So short-term stress is short-term stress is actually adaptive for us. It can assist with healing, and it can assist with our performance. But the problem is when that stress persists for long periods of time. And you can imagine if you go to the gym and if you are curling some weight intermittently, then that can help build your muscle mass. But if you lift a weight and then hold it in that position, flexed, for hours and hours and hours, then it may do damage to you. And that's essentially what is happening with chronic stress, is that we have mechanisms that essentially are adaptive, a revving up of our epinephrine and norepinephrine in our hypothalamic pituitary adrenal axis, which can be helpful in the short term, can help you run away from a tiger if you're being chased, can help you respond to an acute crisis. But over the long term, it can increase inflammation in the body, it can increase our risk of cardiovascular disease, of cancer, of anxiety, of depression, and a host of other chronic illnesses that we care about. And your question is an important one, which is, why is this a problem? Is this a detection issue? Is there a real, true increase in incidence? Well, what we know is that there are several factors at least contributing to this. One, there may be some detection going on because we certainly, I think, pay more attention to this now than we did 50 or 60 years ago. Mm-hmm. But even when you look at the trends, the data is concerning that stress overall may be increasing. And part of that, the reason has to do with workplaces. We have workplaces which are increasingly fast-paced. The idea of being overextended has become the norm. So the idea that you would go to work at 9 and leave at 5 and spend time with your family, when you're not at work, has become replaced with the idea that you're accessible through email and technology 24/7, that you should be able to pick up your phone whenever an issue comes up, and then on weekends you should be available as well in case there are work issues, and if not, you should be working on work products that need to be delivered on Monday morning at 9. So there's been a shift toward a more intense and relentless 24/7 work culture. But there's also been, I think, a change in our social engagement and interaction, which I think has contributed to stress. One of the most powerful antidotes to stress is social connection. And when we lose social connection, we find that we're not able to combat stress as effectively.
But don't we have more social connections than we've ever had?
Well, we do in some ways. But what I'll tell you is that our world is, and our country in particular, are full of people with thousands of friends on Facebook and thousands of followers on Twitter who live in densely populated condo buildings in busy cities who are profoundly alone. The rates of loneliness among adults were around 20% in the 1980s, and those stand at 40% today. Today, which has never really happened before, about a quarter of people, when surveyed, say they don't have a single person who they can confide a personal problem in. These are staggering numbers at a time where we should be technically more connected through social media and other forms of technology. But not all connection is the same. And because somebody is a friend of mine on Facebook doesn't necessarily mean that that's somebody from whom I can receive a great deal of social support or support that can help me diminish my stress. There are some researchers who have looked at this question of how does social media help or how does it hurt us? And what some preliminary research seems to point toward is that when you use social media as a way station, then it can be helpful in improving your connection and diminishing stress versus when you use it as a destination. And what does that mean? Well, if I'm coming to Philadelphia, let's say, on a trip, and I happen to go on Facebook or on another social media platform and look up friends who are in Philadelphia so I can meet up with them and reminisce about old times or talk about how our lives are going, then that could be very powerful in helping me to diminish my loneliness. But if I'm feeling lonely on a Friday night and I say, gosh, I have nowhere to go, let me go on Facebook and just look at people's feeds and see what's going on, and that will make me feel hopefully more connected. That tends not to work, and it often makes people feel even more diminished.
Because everybody else is having a great time and you're not.
Well, this is a great myth, is that if you look at Facebook, there's a fictionalized version, or I should say at least a partial version of people's lives that's put out there. People aren't posting the times where they're lonely and they're lost and confused and wondering about what they're supposed to do with their lives. Sometimes they will, but more often you're seeing them live these glamorous, happy, thrilling lives, and sometimes that can make you feel not so great about yourself.
And there are people on Facebook Live watching all this, and I can sort of feel their heads nodding even as they take part in this. And again, they're encouraged to send questions in our direction. Other factors that maybe play out in this, I think you've said that the things that make people feel stressed, there's money, there's work, and there's relationships and family. But I would have thought health would be in that list too, because certainly for anybody whose health is threatened, that's got to add to it. What's the sense there about the contribution that health is making?
Well, health is a very powerful contribution to stress. And for any of us who have taken care of patients, and for anybody who has had a friend or relative who is ill, or if you yourself have experienced illness, you know that can be one of the most stressful experiences that you have in your life. And if you're dealing with a chronic illness, then that stress can be protracted. So illness is a powerful contributor to stress. But the question is, what are the buffers to that stress? And this is, again, where things like social relationships really come in, because when you're dealing with illness alone, it is a lot more stressful than when you're dealing with it with a family and a set of friends and with healthcare providers who can be there to provide you with support and with compassion. But relationships aren't the only thing that can help when it comes to addressing stress. And the good news is that there's growing evidence that there are other tools that we have in our toolbox, if you will, to enhance our emotional well-being. And those include things like contemplative practices like meditation, which has been shown to be incredibly important and helpful when it comes to addressing stress. Exercise is far more important than we understood, and in many ways can function as an acute and a chronic antidepressant. And we also know that sleep is far more important than we realized. And Francis, you and I come from a profession in medicine that I think has poo-pooed the need for sleep during our training in particular, right? And I remember people often saying, "I'll sleep when I'm dead. Sleep is for the weak." The people who were really strong were the ones who powered through and did multiple call nights in a row and came through quote unquote unscathed. But over time, they really weren't unscathed, because a chronic lack of sleep takes a toll on people. Sleep is when our brain, in a sense, regenerates. It's when we form new memories and build new connections. It's when our body tissues heal. So what you find is in people who aren't sleeping enough, it impairs their ability to make good decisions. It impairs their creativity. It impairs their learning. It impairs their physical health as well. Interestingly enough, we're learning more and more about the hormonal disturbances that develop when people don't sleep. The ratio, for example, of ghrelin and leptin changes in people who don't sleep in ways that may increase their appetite and could contribute to the link that you see between lack of sleep and obesity. There's also a connection between the lack of sleep and other chronic illnesses like diabetes and hypertension and other forms of heart disease. So this is very powerful, but the link between sleep and emotional well-being is also quite profound, particularly with kids. Kids who don't sleep enough have challenges with emotional regulation. They're more likely to not be able to pay attention in the classroom, to get into fights, with other kids in school. So sleep is powerful for kids and also for adults. And if you have any doubt about this, you don't even actually have to go to the literature. You can look at your own lives. Many of us have had experiences where we have not slept for maybe a few days, and we've been grouchy, at work, or we have been less than helpful in resolving a conflict with our spouse, or we have contributed more to disagreement in the household with our kids. We know that when we don't sleep, we're not on the top of our game. But that's not just our performance; it's actually impacting us on a biological level.
Yeah, I think that's pretty profound in everybody's experience, those days where you're really sleep deprived. You lose your sense of wanting to be creative. You're just trying to get through the day. And for an institution like NIH, where our whole future depends on people maximizing creativity, the fact that we are often sleep deprived because of all the other work pressures that keep us going 24/7 is exactly the wrong thing, but yet it seems to happen all too often. You've started then to talk about intervention, so let's go there, because I think that's very much what the world is waiting to hear. Okay, we have a diagnosis that there was way too much stress, too much isolation. Say a bit more about the way in which meditation can be useful in this space. This is obviously an area of intense research at NIH through NCCIH, but what's your general summary of what we know and what we don't know about the actual benefits of meditation, and what kinds of meditation are we talking about?
So it's a great question, and meditation sometimes gets subject to a lot of misconceptions and stereotypes. I've often said that meditation has a serious branding problem because people sometimes think, well, if you're talking about meditation, you're talking about an Indian yogi sitting cross-legged on the floor and in silence for hours and hours chanting a mantra. And while that may be one form of meditation, there are many types of meditation. There's many people have heard of mindfulness-based meditation practices. There's transcendental meditation. There are various practices, but what we have learned over time is that meditation can be powerful in inducing a relaxation response. It is being used more and more at the VA, for example, to help people with PTSD to address some of their symptoms. And there are a growing number of programs across the country that are school-based that are using meditation to actually help improve behavioral issues among kids, reducing violence and improving their performance in schools. Now, I'll give you one caveat to all of this, which is that if we look at the research on meditation and compare it to the research that we have on other interventions like medications for diabetes or for hypertension, there's really no comparison in terms of the quantity or quality of the research. We have far more research on other interventions than we do on meditation.
And it's hard to do a blinded trial.
Yes, and there are some study design issues that pose real challenges with meditation. So we do need more investment in the study of meditation, but we have, I believe, a significant amount of data and certainly a lot of anecdotal experience to tell us that there's something real here that's happening, and there's reason to invest more in that research. I'll tell you anecdotally that I visited a school when I was in California that was dealing with the challenge of high suspensions among their kids. And this is a school that was in a community that had a high degree of violence. There were in fact over 50 murders in 1 year in this community alone. In 3 cases, the bodies of the deceased in those murders were actually placed or dumped on school grounds. And so you imagine being a child who's coming to your school and you discover your school is a crime scene, and in fact it's very likely in many cases the kids knew the person who was murdered because it was not a large community. So the point is that this school was really challenged in a lot of ways, and the violence rate among kids was high, not unexpectedly. Suspensions were high. They tried all kinds of things. They hired full-time grief counselors. They hired security guards to try to keep kids in line. They built sports programs, thinking maybe a distraction would be good for the kids. And nothing really seemed to work. And really, almost out of desperation, they decided to implement a meditation program at the school. And I'll just reiterate, this is for middle school kids, 6th, 7th, and 8th graders. And if you're asking yourself the question, how on earth can a 6th grader learn how to meditate and do that effectively? Well, I was actually asking the same question as well. And so I decided to go visit the school to actually find out what was happening. And when I got there, I spent a lot of time with the kids, with principals, with teachers, and understanding what was happening and hearing from the kids. And what's fascinating is many of the kids were skeptical and they were distracted in the beginning. But what made a difference is at the school, they were persistent. They made sure that they didn't just teach them once and then go off, but they had continued instruction and support for the kids. And I asked the principal, I said, when did you notice a change? He said, 2 weeks in. 2 weeks in, I noticed that the volume in the hallway started to go down. He said, then after that, I noticed that the whiteboard, where we would write down the names of all the teachers who called in sick, that list was getting shorter and shorter and shorter until one day there were no names on the list. And not surprisingly, teacher absenteeism was, prior to this program, very high at the school. Over 1 year, they noticed a 45% reduction in suspensions. That was, in fact, over 75% cumulatively over 2 years. The grade point averages and test scores of the kids went up. Their self-reported health complaints around sleep and anxiety went down. I met one girl who told me that she used to take 2 doses of Benadryl every night to go to sleep. And after she started meditation, she actually stopped needing the Benadryl. And many of the parents started noticing differences. They came into the school and they said, what's going on here? Our kid is a lot more calm at home. He doesn't talk back to us. He's not lashing out as much as he or she used to. So they went from a place where a lot of parents and kids were skeptical to a place where now, when I visited, which was about a month and a half into the school year, they already had 95% of kids signed up, because it's a voluntary program, so kids can opt out. But 95% of them and their parents signed up because they've just seen these really powerful benefits. So there's really something important that's going on there. And we were so compelled by these stories and by some of the growing research out there that our office, when I was Surgeon General, even decided to train in transcendental meditation. So we did, and we would often meditate together. And I'll tell you that it made a big difference for us in terms of our levels of stress, in terms of how we interacted with and worked with each other. Was it a cure-all for everything? No. Did it help significantly? Absolutely, yes.
So those of us who are interested in the brain and how it works, and we have this brain initiative which is aiming to try to uncover the circuits that carry out important functions in real time and understand how those 86 billion neurons do all the things that they do. Obviously, we'd be intrigued to understand more at the detailed molecular level. How does this work? And there will be skeptics out there that until you've actually documented the way in which meditation changes the body's physiology, that maybe we haven't really understood it well enough to be able to say we should promote it. I'm not sure I would agree with that, but there will be people who will say that. So how are we doing in terms of that? What are the needs here if we're going to take this observation and this impressive story you told about the school and reduce that to something where we could maybe refine the approach by understanding more precisely what the mechanism is? What do we need to do there?
Well, first, I think we need to recognize that there is really there's something important happening with meditation in our country right now, and it's happening often in the form of small programs scattered across the country, which may not have the resources or the expertise to study what they're doing. But those examples are out there, and they're looking to be studied. So that's one thing that I say we have to recognize. The second thing is, it's very often that we will recognize something has an effect and then later have to go back and detail what the actual biological mechanism is. And I don't want to underplay the importance of doing that, because it's when we understand the underlying biology that we can often not just deepen our understanding of what's happening, but also find additional avenues for intervention and identify perhaps who may be at greater risk, who needs these interventions more so. And so I think they need to...
Are we talking precision meditation here?
There you go. I had a feeling precision medicine would make its way into this conversation, and I'm glad. It's an initiative I deeply believe in as well. So, but yes, I think that's where a deeper understanding of the biology can really help. But I think that and this also comes down to a question of culture. And we may not think that science is impacted by culture, but you and I both know that is in fact the case. Because what popular understanding and conceptions are influence what gets funded in research. That's just a reality. And the more we have people in the general public, and the more we have policymakers who understand that there is something real happening here that we need further investment to study into detail into research, the more likely we are to get the research, the support that we need to actually conduct that research. So these are some things I think that need to happen for us to deepen our understanding. But look, once we find the intervention, once we understand even more about what works, I think what we cannot afford is to allow the typical 7 or 10 or more years for a proven intervention to actually percolate through to practice. And what we need to really think about is when we look more broadly at the toolbox of interventions for emotional well-being, whether it's meditation or sleep, or whether it's social connection, or whether it's other tools that we've been discussing today, we have to look at all parts of our society to see where we can incorporate those tools. It might be tempting to say, well, stress, that seems like a health issue. The interventions for stress should be addressed by doctors and nurses and other people in the health field. But that's actually not the case, because when it comes to addressing stress, we need a fundamental culture shift. If you think about how we address tobacco, we didn't just say that, hey, the tobacco is a health issue, so this is only the job of doctors and nurses and hospitals to deal with. No, instead we said, you know what, we need parents involved talking to their kids. We need schools engaged, helping to educate young people and put rules in place so that we have a culture that doesn't accept tobacco. We had policymakers involved, helping to put in place legislation that helped to protect kids from advertising and that also helped to raise the price of cigarettes, which made it harder for kids to access. We had many parts of society coming together and saying, you know what, we all have to play a part in changing the culture and practice around tobacco. And that's true here as well. If we want sleep and meditation and social connection and exercise to be tools that are part and parcel of our society and our environment, then that means we have to think about how to incorporate those and support those in the workplace, in the home, in schools, as well as in our healthcare settings.
And what should we be doing, because you obviously spend a lot of time in medical centers looking at medical education. Are we doing a good job, this is a question from Facebook, preparing medical care providers to be more sensitive to the role that stress plays in illness? Or are we setting up a circumstance where that is generally disregarded and left to someone else?
Well, I don't think we're doing a good job at all when it comes to helping healthcare providers address stress in their patients, or even really fully recognize the impact that stress has. And part of it is because we're not doing a good job helping healthcare providers themselves recognize and manage the impact of stress on their own lives. That's reflected often in how we train clinicians and the culture that we create around training. If you think about it, what's valued is in medicine. If you go to grand rounds, if you go to morning report where cases are discussed, if you join teams for rounds, you'll find what's often valued greatly, or perhaps even most, is medical knowledge. Yeah. Now, is medical knowledge important? Absolutely. But I had one fellow resident when I was in training come to me in exasperation and say, I feel like the only thing I have to add to patients is that I'm able to build connections with them and just form trusted relationships. But beyond that, I just have nothing to add. I just can't keep facts in my head or anything. And what was really striking to me is that she saw so little value in the fact that she could build trusted relationships with patients. And she didn't start off that way, because I knew her actually when she was in medical school. But she had grown up in a culture which essentially told her that stuff is not so valuable. So unless we change our culture within training to help our newest clinicians, doctors, nurses, PAs, dentists, and others, recognize the importance of emotional well-being and stress in their own lives and lead by example, unless we do that, then it's going to be hard for them to really translate that into how they care for patients. We've all seen the stories and the cartoon figures of doctors telling their patients not to smoke while they're smoking themselves. Those old cartoons from 3, 4, 5 decades ago. We are unfortunately doing that with stress. Yeah. In many ways, we're telling people to relax, to take it easy, to get some sleep, etc., while we ourselves as clinicians are running ourselves ragged and paying no attention to the profound impact that stress is having. We need to lead by example as clinicians. We need to be a part of changing the culture in the country around stress, but that starts with our own culture in medicine.
Can't help but make a little comment here that here in our own clinical center, the largest research hospital in the world, this attention to emotional well-being of the patients who come here has recently been recognized in a very dramatic way by a competition amongst 426 healthcare delivery centers where they asked patients about their view of whether they were receiving emotional support. Out of those hundreds of institutions, the number one ranked institution for providing that emotional support, the NIH Clinical Center. So congrats to all of you. I'd like to say that all the people that work in the clinical center are completely themselves stress-free. Yeah, that may be going a little too far, but apparently you take care of your patients beautifully.
I do want to say, Francis, one thing that makes a big difference here is leadership by example, leadership from the top. So the fact that you are sitting here as the head of NIH talking about the importance of addressing stress broadly throughout our community, including in the workplace, that sends a powerful signal to people throughout the NIH that that stress is not evidence of weakness or personal failure, but it's a reality of life and that we have to collectively figure out how to address it. And that's very powerful. I was recently at a roundtable with the Dalai Lama and a few business leaders where we were talking about how to actually address stress and emotional well-being in the workplace. And one of the leaders there, as a CEO of a major company, had gone through his own experience with illness and who had realized that emotional well-being needs to be prioritized for people, not just when they're ill, but really throughout the lifespan. And we got to start right here in the workplace. And so he invested at great personal risk. He pushed his company to invest in the emotional well-being of his employees by developing programs that were centered around meditation, by developing other spaces where they could help strengthen and build social connection. And now, you ask employees about that program, and not only are they doing tremendously better in terms of levels of stress at work and their performance at work, but they feel more comfortable in their work environment. They feel like, okay, this is a place where real things that we were struggling with, like our levels of stress, are things that we can actually talk about. We don't have to sweep them under the rug. We don't have to keep them with us and tuck them away when we come into work. But our leadership recognizes that this is real and that it's affecting us. So I want to commend you and Dr. Briggs for bringing this issue to the forefront. And if we have more and more institutional leaders doing that around the country, then I believe that's a big part of how we can start to shift the culture around stress and emotional well-being.
Vivek, last time you and I were sitting in an interview setting somewhat like this, we had one other person on the stage. It was Renee Fleming, and this was part of the Kennedy Center NIH joint effort called Sound Health, where we were exploring the ways in which music can, in fact, provide relief to people suffering from pain or from stress disorders like PTSD, or even as a treatment for such things as Alzheimer's disease or people with traumatic brain injury. Say a little bit about your sense how music and the other arts can, in fact, also be a part of the therapeutic toolbox that we ought to be considering tapping into when stress is otherwise getting the best of us.
Yeah, well, music is very powerful in inducing a relaxation response. And in that sense, it is absolutely part of that emotional well-being toolbox. It was actually delightful to do that event with you and Renee. I was sitting there with the three of us on stage thinking to myself, two of these people are like each other and the other is not, and that was me, the person with no musical talent. Both of you are incredibly musically talented. And if you haven't had the chance to see Francis perform, he's absolutely incredible, and you can find YouTube videos.
Oh, they've all had to suffer through it. It's okay.
So anyhow, but music is incredibly powerful, and look, there are actually some interesting studies that have been done on this. McGill University put out some really interesting data showing, for example, that the impact of music on reducing anxiety levels can be, in fact, even more powerful than anxiolytic drugs. Mm-hmm. There have been studies in ICUs which have been found that using music can, in fact, reduce cardiac workload and improve oxygenation and, in fact, improve ventilation in patients who are ventilated in intensive care units. What you find also when you look at various populations, including kids, is that music can help relax and reduce stress. And so as we think about it, it's important that we recognize that since stress is prevalent everywhere, whether it's in the workplace or the hospital or anywhere else, that music can actually play a powerful role in those settings. When I was practicing medicine at Brigham and Women's Hospital up in Boston, there was a harpist who used to make her rounds and come to different pods in the hospital. And I loved it when she came by because everything felt like it changed. When she would just sit in the corner and she would play. She would not say a word to anyone. But things just seemed to move slower, and they were calmer when she was around. Conversations with people just felt more relaxed. And all of that was in my head. But what's in our head makes a difference. Our perception of the world is what can activate or not activate our stress response in our body. And music has that very powerful ability to change how we perceive the world and to activate that relaxation response. So I think music is very powerful. And this is where I think open-mindedness is so important when it comes to addressing stress. Open-mindedness has been a hallmark of science, but we have to protect that. We can sometimes get closed-minded in science, but the willingness to be open to new ideas and new therapeutics, the willingness to say that, you know what, a potential Marvel therapy could come from anywhere, and including from unexpected places. That's incredibly important in science. And I think 50, 60 years ago, if you had brought up the idea of bringing music into hospitals or into hospice centers, saying, hey, this could help people, people would have said, that's probably, they would have said it's all in your head. But, in some sense, they were right. But what's in your head matters. And it particularly matters for your perception of pain. And there have been studies also in hospice settings showing that music can, in fact, have a positive impact on perception of pain. And at a time where we are struggling with an epidemic of opioid use and misuse, at a time where we have record numbers of people who are tragically dying from opioid overdoses, it is not trivial for us to think about the role that music and other tools like it, including meditation, can play in reducing people's perception of pain.
Very true. Josie sent me a couple of articles in preparing for today's conversation, and the particular focus of one of them was on the way in which childhood stressful circumstances can set up an individual to be lifelong susceptible to not the healthy kind of stress, but the unhealthy kind of stress, with experiments showing how this is true in animals and how epidemiologically it also seems to be true for humans. So I would think, as someone who's trying to convey this message about this malaise that we have based upon stress, that focus on children is going to be particularly critical. Your anecdote about the schoolyard circumstance and the role that was being played there by trying to relieve that stress is illustrative. Is this finding its way enough into the way in which our country is trying to address the way in which our children are growing up? We think about a lot of other things. Sometimes it's just crowd control. Sometimes it's about such things as nutrition. But I don't know whether stress itself, from the child's perspective, is necessarily as prominent as maybe the data suggests it should be. What's your sense of that?
I think we have a long way to go to help people really fully appreciate that stress plays a pivotal role in the health of children. I think at very extreme levels, people may recognize that. If a child has been the victim of an attack, then we recognize, okay, that may have an impact on the child and we need to take care of the child. But there are many other sources of stress that are more chronic and day-to-day in a child's life, which can impact their health later on. And this is where the ACEs study was very helpful. So ACEs, many of you may know, stands for Adverse Childhood Experiences. And what the ACE study really helped to uncover was the impact these experiences can have on health in the longer term. So what are these experiences? Well, they're experiences like physical violence that a child may experience, emotional violence, sexual violence. If they have a home in which a parent is divorced or where substance use is occurring, if they actually see their mother actually being the victim of violence. These are all some of the various adverse childhood experiences that this study actually tracked. And they assigned a point to each of these experiences. And what they found is really profound, which was that there was a dose-related response when they looked at the number of experiences that people had and their likelihood of developing a series of chronic illnesses afterwards. So they found, for example, if you had an ACE score of 4 or greater than 4, you had a 7 times greater likelihood of developing alcoholism. Your likelihood of developing emphysema was 4-fold increased. Your likelihood of developing cancer was doubled. And if you had an ACE score that was greater than 6, your likelihood of completing suicide, or at least attempting suicide, was 30-fold greater than somebody who had an ACE score of 0. These are really profound experiences, and people used to say, well, maybe that's, again, all in their heads. Maybe this is, kids get stressed, and maybe it's mediated by bad behavior, and quote, I'm saying bad behavior in quotes, as we think about, traditionally used to think about cigarette smoking and drug use, and now we know these are really addictions. But what we know is when you look at imaging studies of kids who have gone through these experiences, there are actually visible changes in their brain. And we know that this is really these experiences have a profound impact on kids. It's not surprising in some ways that this would be the case, because we know that childhood is a time of intense development of the brain. We know, for example, when you look at the area of addiction, that a child who's exposed to addictive substances is much more likely to develop an addiction later in life than somebody who's exposed to those addictive substances when they're an adult. And the differences are really profound. So while it's not surprising, the real question is, how are we going to address this? How do we help prevent children from being exposed to these chronic stressors in their homes and their communities? And once those stressors present themselves, how do we then equip kids with tools to deal with stress, some of the emotional well-being tools, in fact, that we've been talking about today, including tools for emotional regulation. And this is the deeper question we have to answer. I was talking to somebody yesterday, a very thoughtful and successful entrepreneur and philanthropist to his 3 young sons, and he was sitting at his school waiting for his kids to finish the day when I was talking to him. And he was looking out there and he said, I'm going to tell you that to me the most important thing for my kids that I want them to get out of their education is not how much math and science they know, not how much literature they've read, but it's the tools and the skills to be able to lead a healthy and fulfilling life and to be able to manage stress and their emotions. Recognizing that has a profound impact on whether kids graduate, it has a profound impact on teen pregnancy, on their risk of physical illness, and on a whole host of other things that we care about. So, like all things, prevention is better than cure if we can get there early enough. Getting to kids early is, to me, the most important form of prevention. Historically, we've not done a great job, Francis, as you know, as a country, in making prevention a priority. We've tended to invest more on the treatment side, and for that reason, we have some of the greatest treatments in the world, and that's something to be proud of. But I think it is high time that we invest more in prevention. And I can't think of a better place to start than our kids.
Can't help but make a comment that it is ironic, isn't it, that even as we have this data documenting the impact of severe stressful events on childhood in terms of lifelong events that follow after, we have this other movement which many people have pointed to of trying to keep kids from experiencing healthy stress, because everybody has to have a trophy, and that reduces perhaps the resilience that kids might have when things do come along that are stressful. We're giving sort of the best of both, the worst of both worlds in terms of the way in which we manage the stress that's coming at them. We got a lot of work to do in that space.
We do, and I would remind everyone about the example of lifting weights in the gym that I brought back earlier. You don't want to continue that metaphor, you don't want to prevent a child from ever lifting a weight. You want them to lift weights periodically, to experience challenges in life, to grow as a result of those, the same way your muscles grow when you challenge them at the gym. But you want to do that intermittently with adequate support around. We know, for example, that if you're going to work out in the gym, that making sure you have adequate nutrition and sleep is incredibly important to ensuring that your body actually gets stronger as a result of exercise. So for kids, we want to expose them to challenges, but we want to do so intermittently and make sure that they have the support in their lives in terms of trusted relationships and family, in terms of sleep, in terms of their nutrition, so that they can ultimately grow from those experiences and not diminish.
Indeed. Well, we have only a couple minutes left. This time has flown by, and I apologize to all the people who sent wonderful questions on Facebook and Twitter that I didn't get to, and also the people who sent staff questions. It was such a rich conversation that I didn't need much help from anybody. You just kept us going. But Vivek, if you have any sort of parting words that you'd like to share, both with the people here and those watching on the video, please do so.
Well, I just want to say how thrilled I am to have the opportunity for us to be here to talk about stress. I talked about the importance of having a culture shift in how we think about and address stress. The fact that we are sitting here at the NIH having this conversation is one example that this culture is starting to shift. And I want to thank Mrs. Strauss, the Strauss family, and the late Dr. Strauss for all of their contributions, which have made it possible for us to come here together today. And Mr. Strauss, I just want to thank you for sharing your husband with the NIH and with the world for all the great contributions that he and that with your support was able to make. But as we think about stress, I want us to recognize that we have in part been talking for most of today about stress in an individual context. We've been talking about tools that you can use in your own lives, a toolbox, if you will, that will help you to manage stress and thereby enhance your ability to live a healthier, stronger, more fulfilling life. But I also want to recognize that stress is not limited to the individual, but it affects us on a societal level. We need to be concerned not just about our stress, but about the stress that people around us are experiencing. When somebody experiences a great deal of emotional trauma and stress and they don't have tools to deal with it, when that results in acts of violence, that affects all of us. When we have stress that's unchecked, that leads to greater levels of addiction in our country, that affects all of us. And when we have a great deal of stress and emotional discord that prevents us from being able to come together and talk about big problems as a country and come to solutions, that too affects all of us. So as we think about how to address stress in America, it's important we recognize that we have to go beyond addressing it in our own lives, but we have to think about how we can help to improve stress for people around us. Because social connection is such a powerful tool for addressing stress, the steps that you take to reach out, to build connection with someone, connections that are based on compassion and kindness, those can have a profound impact on the stress that someone else is experiencing. That can change the work environment for them. We know actually from data that people who say they have a best friend at work are much more likely to stay in that job, to be productive, and to not burn out. So to the extent that you can reach out to family and to friends, to coworkers, and help create an environment that is less stressful, it's to that extent that you can help us address this epidemic of stress in America. Because ultimately, the question we have to ask ourselves is, what kind of country do we want to live in? The country that my parents brought my sister and I to was a country that they envisioned was one that was based on some fundamental values of respect for everyone, of equality for everyone. They believe this was a country where my sister and I would not be judged by the color of our skin or by the fact that we had funny-sounding names. They believed that we would be judged by our ability to contribute, by our ideas, our willingness to work hard, and that we would be supported by a community of teachers and neighbors and others who also cared about our well-being. And that's the country that I believe we still are at our core. That's the country that I saw as Surgeon General when I traveled to big cities and small towns all across America. But to many people, that doesn't feel like the country that we're living in, and it hasn't felt that way for many people for a number of years. And so our job, not just as individuals, but as members of this larger community in America and as a larger global community, our job is to think about how we create a culture that truly does value and support everyone, that helps to address stress partly through this very powerful means that we have of social connection. And if we can do that, I believe we can build a country that is more compassionate and that's more kind, a country that is not weaker, but in fact that recognizes that our emotions, when properly cultivated and directed, are our greatest source of strength. And that's the kind of country that I want for my son, who just turned 1 a couple of days ago. It's the country that I want for your children, and it's the country that I believe all of us deserve.
Bravo.